Okay, time for us to share a daily briefing with you on KLAM and KCDV. These are hardly qualify as daily anymore, but we have them when we need them. And with this recent announcement by the city that some things in terms of the city's reporting and the regular meetings, the regular operations of the response team and that kind of thing, some changes were announced yesterday. That's raised questions, so we thought it'd be a good idea to address some of those and try to get context from the person who has been our most constant voice through this and consistent voice, and that is Dr. Hannah Sanders. So you'll hear this at 1 p.m., 5 p.m., and 8 p.m. on the radio. Then we'll put it online like we have all of our other briefings. And we will begin our visit with Dr. Sanders right about now. Hello again, Doctor. Let's dive in. The news release from the city says no more publishing of case counts on a local dashboard starting today, Friday the 21st. So you touched on this actually just very briefly kind of at the end of our last chat, but it's more of a main theme now. So why the decision to move in that direction?
Well, it's really twofold. One is that the medical response team feels right now that we are at a time where prevention and treatment for COVID-19 can be integrated into normal medical operations and into our daily lives. And the medical response team can continue to focus on their primary jobs and not be putting as much extra effort into monitoring case counts and disseminating information. Right now, the case counts are, we feel that the data that we're getting is not entirely accurate due to home testing. This is kind of a natural progression. It's something that we expected to happen, but we do know, we think probably even more than half of our cases are going undetected locally because people are testing at home. When people get a positive test result at home, they tend to change their behavior and still take on those more cautious infection control practices so they don't spread the illness. So this is a natural progression of the pandemic. It's something that we wanted to happen, is happening, and we feel very good about standing down at this time. We've been working on demobilizing our efforts really for the last 6 months. So.
Right. Yeah. Well, I mean, there was always going to be a point at some point where this would need to happen. And again, you see even, major news outlets like the Associated Press is sort of one of the gold standards talking about how life with COVID as part of our lives is, they're saying, for example, a lot of emphasis on case count doesn't make any sense. And so anymore, it's really more about hospitalization and death and, the outcomes because this spreads, particularly this current version spreads so rapidly and yet is not creating the kind of, am I remembering the data right on that the proportionally the number of people that you have getting it compared to the number of people ending up seriously ill enough to end up in the hospital or the becoming fatalities, that it just is the hospitalization and death numbers don't rise proportionally like they used to?
Yeah, they're not rising proportionally with the number of people that are infected. That being said, across the country, we do see huge numbers of people infected. And with those large numbers, you do see high numbers of people seeking emergency services and hospital services. There certainly are areas where the hospital capacity is struggling. Locally, that is not the case. Our hospital capacity remains intact. I think that's in a large part due to the high vaccination rate. The vaccine has made a dramatic impact on survival and hospitalization, like you said, and we have a very high vaccination rate here in Cordova. We also have a decent natural immunity rate, which is also protective. So yeah, those two things, coupled with how well prepared we are locally, we feel really confident in our hospital's ability to respond.
Yeah. Okay. Now, of course, there are going to be some people, I'm sure, who feel that why begin this sort of a degree of official standing down at a time when case counts are rising again, because everybody's used to thinking of case counts. So, I mean, excuse me, what is your your sort of response to that? That might seem like a counterintuitive time.
Yeah, I could understand people kind of feeling surprised that we decided to stand down when we are in the middle of an outbreak. Again, we've been preparing to demobilize in this way for many months. And at this time, we also know that the numbers that we have, like we mentioned, are underreported.
Mm.
And we don't know that reporting those numbers and treating the data in that way is continuing to provide any increased safety for the community. I think over the last 2 years, we have learned so much. When this started, the medical response team came together and said, here, we've got this unknown pathogen. We do know that people that are getting this illness are acquiring large amounts of oxygen. We looked at our local oxygen supply. It was incredibly low. We also didn't have enough PPE. We didn't have ventilators. We didn't have a lot of the equipment that's needed to isolate people with this illness. So this team went to work figuring out, following any data that we could find, and attending online meetings to make sure that we had the most up-to-date current information, and just worked 7 days a week into the evening, procuring equipment and getting all the necessary supplies. Then once we had vaccine, we worked really hard day and night to try to roll out vaccine quickly to our community. And now we are at a point where we have had those responses. We've procured everything we need. We've got vaccine available to the community, and we're feeling like our job is done in that regard, and this can really be integrated into our normal operation.
Yeah. But on the flip side of that now, I mean, you've got some people who think that, as long as one person has it, that there should be an instant response team and a bunch of mitigation measures and that kind of thing, which is probably going a little too far, one way. On the other hand, I imagine there are people out there who are saying, hey, see, they're standing down. That validates all of the things I've been saying, that it's not a big deal and it never should have been, and, all that sort of stuff. So, I mean, this is just a sort of a public policy change that doesn't necessarily, you're not trying to send the message that the pandemic is over with this, right?
No, absolutely. And on both sides, I absolutely don't. The medical response team standing down right now is not trying to send a message of that we aren't concerned with COVID or recognize the absolutely humongous impact that this infection has on people. I have firsthand experiences going into larger ICU settings and caring for people that I've had to help facilitate the conversations over the phone, saying goodbye to their family before we put them on a ventilator. I've seen some people survive after months in an ICU. And, one of my friends recently that I went to high school with has been intubated and in an ICU for 2 months. And yesterday she was able to celebrate that she was able to stand up on her own feet for a handful of seconds. This infection has had a huge impact on a number of people across the country and across the world. And it's scary, and it's something that I feel very proud of, the response that we locally work together. We've worked really hard to try to help prevent this from spreading really quickly while we could procure the resources that we need to be able to respond. I think that the team has done an excellent job. I think this is a safe time for us to stand down because we are ready and we're capable of treating COVID. And I absolutely do not want to be minimizing the effect that this illness has had on people, and I don't want them to feel like we are ignoring the risk. We aren't. We're still prepared to respond to it. And we appreciate everybody's support over the last 2 years.
Didn't you mention, too, also that the recommendations for mitigation, I remember early on, and I was a very big advocate of this, that, Cordova needs to look at Cordova's needs and, respond in a Cordovan way when all of this is brand new, because certain things that could happen in a town with an isolated population, that we would need to respond very differently than somebody in Anchorage or Seattle or, some big community like that. It seems as this whole thing has evolved that, as you mentioned, that last time we talked, that you can feel a little more confident looking to more standardized mitigation measures now. Am I understanding what we talked about before there correctly, that, the advice that, say, comes out of Anchorage, that comes from our state health officials, probably applies just about everywhere, that we can have a more uniform set of ways to respond to this?
Yeah, I think early on we really kind of maybe hoped that our geographic isolation would prevent us from having to be the first to deal with some of these variants as they came. What we've seen over the course of the pandemic is that our population in Cordova travels a lot, and we tend to see variants very early on when they pop up. So I think that really looking at this from a regional perspective and being able to follow the public health experts and epidemiologists and what they're recommending at the state and even national level, we recognize that we really can do that. Yes, we are geographically isolated, but we're very connected to the rest of the world.
Well, and we're also, like you
locally,
said, like you said, we're also much more vaccinated. We understand mitigation measures better. It's just not the same situation as it was.
Exactly. Here locally, we are able to respond very quickly when it comes to deploying things like new treatment options and getting vaccine out, because we have this group of people here that are just willing to do whatever it takes and whatever is necessary to support their neighbors and help the community. So that's been a very fulfilling part to see how everybody can and is able to come together.
So again, this announcement that came out that case counts won't be published and that the medical response team is standing down essentially is just really more of a public policy thing. It's sort of a here's what the government people are going to do, but that doesn't mean that that individuals, families, businesses, whatever, need to think of the state of things any differently. It's just more that they can look at the state numbers and the state mitigation recommendations rather than feeling like that all needs to be filtered through a local team. Does that sort of boil it down?
Exactly. We're really encouraging those. As long as we have a regional outbreak in the state, we can know that we still have an active outbreak here in Cordova. And people tend to also know when there are people that are sick or test positive, just because we're a small community. So we want people, we want institutions, we want businesses to really look at the guidance from those larger entities. The Department of Health here in Alaska has done an outstanding job of keeping up to date with the literature and providing excellent guidance that really suits Alaska. So we want people to continue to look at those resources for how to respond and how to keep their businesses and families safe. And we'll continue to have vaccine and offer boosters to anybody or initial vaccination to anybody that wants it. Even with the Omicron, I know that there's some talk of the decreased efficacy in the vaccine. The vaccine and the booster it does an excellent job of preventing hospitalization and death. It isn't preventing infection. People are still getting symptomatic infections, but we see some excellent data out in New York that shows that the unvaccinated people are 8 times more likely to be hospitalized with Omicron.
Yeah.
So we know the vaccine provides excellent protection. It's really our best tool to prevent some of the really horrible complications that come along with COVID. So if I can encourage a single person to come and get vaccinated, I always feel like that was, I had a great day or week when that happens.
Sure.
We'll continue to offer those things and continue to offer any treatment options as they do become available. We anticipate more antivirals to be becoming more widely available. We continue to have the monoclonal antibodies as well as remdesivir. So the medical team we will still be working on all infectious illnesses, COVID included. We're not ignoring this. We are just stepping down as a emergency response team. Okay.
Yeah, and there may still be some questions, and I hope that if people have them, that they will let the city know or let us know. If people are listening to this and want to email us a question or send us one on Facebook or whatever, then we can certainly have a chat at a later date to try to answer some of those questions. But for the most part, it just sounds like our local experts essentially are saying you can look at the numbers in the state and the mitigation measures recommended by the state, and you just kind of don't need the city as a middleman in that anymore. So let's do our fabulous final softball right down the middle. Any final thoughts as we button this up?
I think that I just want to take a moment and recognize, I won't put everybody's names out individually, but the medical response team, I've gotten a lot of recognition because I end up being the voice of the leader for the team. However, over the last 2 years, we've had about 10 individuals that have just been so strongly committed to Cordova. They're volunteering their hours, evenings, weekends, every chance that they have free, they're spending digesting current literature and following up with the state with meetings to make sure that we have the best level of evidence and equipment available. I just think that the medical response team has done an outstanding job. They're working silently and anonymously, and I've been really proud to get to be a part of that team and watch everybody work over the last 2 years. So I just want to give a shout out and a thanks to them, and thanks to you for everything that you've done to support us too.
Oh, glad to do it. And I mean, I assume, obviously, that while this sort of regular operation for the response team is winding down, that if we end up with a problematic situation, that you and I will still chat and announcements from the city will still come out and so forth, right?
Absolutely. I think that the last 2 years has built this collaboration between the hospital, Alanka, the city, and you, as well as some of the other news outlets. I think that those ties will continue. And of course, if there's ever anything that needs to be addressed or information that needs to be put out publicly, we are all very well connected and will continue to put those public notices out.
We all know each other's numbers. Dr. Sanders, Thank you very much. Please pass our appreciation on to all of those folks that have been working so hard. And of course, we'll continue to keep this time open and monitor things and share information as it comes through. But I appreciate the time today, and until next time, hope you stay safe and smiling.
Thank you. You too.
Big thanks again to Dr. Sanders for the chat. Again, 1 p.m., 5 p.m., and 8 p.m. on the radio, and then youtube.com/Cordova TV. If you would like to hear this program on demand, once we're able to get it up there, or share it with anybody else, you are welcome to take advantage of that asset. For general information, if perhaps not a dashboard, but just general information about the city's COVID status, go to the city webpage. And again, the information that the state puts out will be very effective for guiding Alaskans across the state, as the knowledge base has grown so much since this whole thing started. So if you want to know what the latest recommendations are from our state health officials, then simply going to alaska.gov and going to the COVID section of that website will provide all the information that you need on how the state as a whole is doing. We will, of course, keep an eye on things, and if you have any questions that you would like us to put together for a later discussion on this, we're happy to do that. In the meantime, we will thank you again for listening and get you back to regular programming on the Clam and the Eagle.